Right, Health Minister Dr Zweli Mkhize is also expected to visit the Eastern Cape today. This as the province has registered 310 confirmed cases of the virus. His first stop will be in East London, a call centre. Our reporter Abongile Jantjies is there. Let's cross live to him. Abongile, we've just spoken to Atule about the minister's movements in that province today. But what is he expected to do at the call centre?
Good morning to you, Desiree. Indeed, the minister has arrived and is here at the call centre, currently having a briefing with the Health MEC, Cindy Swakomba, to talk about the ways in which to combat this virus, Desiree. He'll be inspecting the call centre to ensure that there are enough staff to make sure that people get the necessary information that they need. Well, funerals have been part of what is being discussed there, as it is a major thorn for the province, as many people are not adhering to the lockdown regulations here in the province. Well, he's expected to go to Ngatu Great Place. In the meeting, there is also the officials from the Correctional Services Department, where they are discussing the number of inmates who are infected and ways in how to deal with them. You'll remember that there are cries of overcrowding in that prison. But to tell us more now, I've just managed to get hold of the Premier, Oscar Mabuya, and was also part of that meeting. So thanks a lot for your time. The Minister is here. What are you hoping to achieve from this meeting behind us?
Thank you very much. Good morning to you and good morning to viewers at home. As you have indicated, you have just actually pulled me out of a meeting with the Minister where we are briefing him about work that we are doing in the province since the outbreak started. We are also indicating challenges that the province we might really be going through. When we started this, we knew very well that the inevitable is unavoidable, and some work must be done. We were hoping that embarking early enough to prevent the spread to our province was going to be helpful, but we see that the strategic or geographic location of our province and its link to other provinces like Gauteng and the Western Cape make us to be more vulnerable day in and day out, as many of our people are there, and the movement of our people between these the provinces. So we are also indicating how we are working so hard in ensuring that we contribute on flattening the curve and ensuring that we stop movement of the people and we ensure the enforcement of the regulations on the ground. It's not easy, of course, but also understanding the health care facilities in our province, the challenges around that, but also looking more for the field hospitals, the national contribution towards that and helping us. Today we are at 310. The numbers are going up. They are going to go up before we are flattening the curve, up until they reach that particular optimal point. So we are hoping that as they grow up, but they are going up at a lesser rate. And we think that our earlier intervention has helped, even though it has not yet yielded the real dividends that we would have wanted to see. We didn't want to see any infections coming up more, but we're doing relatively good in terms of ensuring that where we have picked up the positive case, we follow through, we deal with the tracing, where we screen, we also test. We are working very hard. We are way above 200,000 now on pre-screening people, and we are almost close to 5,000 on testing, particularly to those who have shown symptoms. We know that many of people are asymptomatic around this particular virus, but we are also opening it up. Now we are on a massive testing. We are looking for a virus wherever it is, wherever it shows this ugly head, so that we tackle it as other people are not showing any signs. So where we have a case, we make sure that we screen, we test the entire community, be it in rural, be it in township, be it in affluent areas.
Premier, the number of not adhering to the funeral regulations of 50, I understand that as a province you want to reduce it. Can you please talk more on that? Instead of this 50, which number are you aiming for as a province, since people are not complying to it?
We were hoping for the suspension of funerals altogether between now and the end of the last remaining period of the lockdown. We were really hoping for that, but what we are saying now is part of enforcing the regulations around funerals, because funerals are the biggest risk, are the biggest threat to the people's lives in our province. All the outbreaks that we have are linked directly to funerals, and we know exactly what's going on in our funerals, because our funerals generally are more eventful than being funeral with lesser numbers. Whether it's 50 or not, the issue of getting masks and everyone wearing a mask is important. Even not in funerals, wherever people are going, we're saying let's embark on this massive distribution of masks so that our people are wearing masks, those who are in towns. But in funerals, we're saying let's stop cooking, let's stop catering. People must understand that we are at war. There is no time to cater for people and eat when you are at war. We are fighting this invisible enemy, and it actually finds itself where people are. You look at young women who are preparing food for funerals. At that point, it's another center for the virus spread. You're looking at young men who are preparing graves. Even there, it's another area for the virus spread. So we're saying all those issues are a risk on what we're trying to do. So it's important that we change completely how we're dealing with issues of funeral. We change our attitude. I know it's almost a kind of ritual in other people, the issues of dignity. Our people have been actually given a dignified funeral without being eventful, without being glamorous. So it's a time that people realize that we can keep at 50, but we want attendance registers, we want contact, we want masks, we want full compliance with the regulations in those funerals, and we're doing that. In towns, we've got a problem in our towns. The half population of this province is staying in rural areas. In rural areas, there's a huge underdevelopment backlog. That is historical. Our people, for them to get food, they must move from their areas into town, wake up as early as 5 o'clock for them to get into town. They stay into town getting food. By 9, some have not yet finished. They are locked in town the whole day. And we're engaging national. We're talking to the minister. Let's review these regulations around this. Let's allow people to come in and buy food, but let's allow them to go out. After 9, don't allow anyone into town, but allow those who are in town out, because if you don't allow them, they are now congesting in town. We have got big numbers in town of people who are staying the whole day, loitering in town, waiting for 4 p.m. So it actually defeats what we are trying to do. So we are making that plea. We are engaging also all ministers around that to ensure that, or we have times of those retails or supermarket being regulated. Either they open in the morning at 7, they all close at 12, so that we locked down towns. Because if we don't do in our rural areas, this virus is going to get into every household, because our people are going into towns every day. We want to appeal to our people, stay at home, comply with actually hygiene regulations, wash your hands regularly, keep social distancing as it is recommended. Those 3 are critical and are important. But you can only observe those if you are at home. If you are at home, there will be no virus, because the virus moves with people. If there are no people on the street, the virus will be dislodged.
Premier, speaking about compliance, on Friday or Saturday, there was this ANC councillor who was caught with alcohol in his car and running away from law enforcement. What do you have to say about that?
That is non-negotiable. It's very clear. ANC is an agent for change, is the leader of the society. Not only ANC, every public representative are expected to be the one that are monitoring and evaluating these regulations. You are forced to do an oversight. It can't be us who are found on the wrong side of the law. That one is non-negotiable. You do that, you actually fall on your sweat. So it's clear, and then we are appealing to political parties. They must prevail on their members, on their deployees in government, so that people understand the seriousness of this. Because if our people don't see leaders respecting these regulations, why would you expect them to respect these regulations? So we are dealing with that issue, political and otherwise, so that we are also sending a message to everyone. We are happy that the comrade concerned has resigned voluntarily as a chief whip. He has also asked to be given a 3-month leave so that he attends to these issues. So it's a kind of a leadership that we would expect from everyone. But we are forcing everyone, traditional leaders, religious leaders, everyone must comply. It is important. We are role models. Our people must see something better from us.
Thank you, Premier, for your time.
Thank you.
Well, there you have it, Desiree, the Premier outlining what they are expecting to get from the Minister's visit. Well, it's still happening, and we are hoping to get an interview with the Minister when they are done there. From us here, it's back to you in studio.
Thank you very much for that update.